if you understand stramonium by the general idea of what a lot of our homeopaths generally give, in all materia medica, stramonium is given as a remedy for mania, for insanity, for delirium. But today I'm also going to give you an idea how you can, just by the way of patient's expression, the way of his talking, how he behaves, how he doesn't behave, how you can come to stramonium. All parts of stramonium have alkaloids of atropine, hyoscyamin, scopolamine, and these are often many deliriants and anticholinergics. Also called as datura stramonium. Called as datura stramonium. Datura, intoxication, causes delirium, hallucinations, tachycardia, bizarre behavior, urinary retention, mydriasis, photophobia, and so on. Historically, in many places, stramonium was used for its hallucinogenic properties. Datura has its origin in India also, where a sister species of stramonium, Datura methyl, was considered sacred, believed to be favorite of the great lord of India, of Hinduism, Shiva. So many saints, they would use this typically along with cannabis, along with Aconitum ferox, for different experiences, for liberation, for moksha, for spirituality. So it's interesting. It's interesting to understand this in context. One of the main primary active agents in datura is atropine. It's very interesting here. The Chinese also have used it in form of anesthesia. What is the main thing for me for stramonium? The main feeling. Let's come back. So very interesting rubric. I want to explain you this. This is a very important thing what I'm trying to tell you. If you understand this, you will understand entire remedy. So look at this rubric. Delusion. Dogs attack him. Delusion. Dogs biting and tearing flesh off his chest. Delusion. Dog large. What does this mean? First of all, remember it's a delusion. It's not the truth. So stramonium, the patient's stramonium, even if he looks at rat, even if he look at mice, even if he sees a small injection, even if he sees a needle, even if he sees little water, their imagination goes as if they feel the experience, as if the dog is coming and biting his chest off. This is the experience of smallest of things for them. If a dog comes and bites your chest off, you're obviously going to be very scared and run the hell out of here. But if it's not a dog, if it's a small mice, if it's a small insect, it's just an ant, but you start reacting or you start imagining it or you start experiencing it as if the dog is coming and biting that screw up out of your chest. This is the state of stramonium. This is a very important experience I want you to remember. Every time you think about stramonium in your life, you have to think that the patient of stramonium is starting to imagine his or her whole life as if someone is coming and just biting the chest off. Remember, plain Jana. This is stramonium. A little deeper. Let's go a little deeper. So what is the reaction of stramonium? What is the reaction? The reaction is Call the doctor, call the doctor, call the doctor, 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 please help me, help me, help me. Or he will call his mother, mama, mama, please help me, help me, help me. Why, mama? Because in this state of fear, the stramonium almost behaves like a child. There is no maturity, there is no brain involved here. There is no intellectualness involved here. Stramonium goes at an impulsive level because for the first time, stramonium in a state of lot of stress starts reacting with flight fright reactions. It's almost his sympathetic nervous system takes charge of his life. So for him, the only way out is either run away, that is escape the situation of life, or clinging. They cling, please help. So look at this rubric: clinging children, awakened terrified, knows no one, scream to those near him. Understand this very beautiful rubric. A patient comes and tells you, doctor, 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 I did a sonography. It shows there is ulcer in the stomach. What will happen? What will happen now? I don't know what to do. So I saw your name there written, Dr. Gaurang. So I came, please help me, please help me, please help me. I know only you can help me. Please help me, please help me. I don't know anyone. And you tell me whatever you do, I will do it. So what does this whole phenomenon mean? Clinging. First of all, the patient is clinging to the doctor. Only you can help me. Number two, clinging children, which means a 40-year-old adult starts behaving like a children. Awakens terrified, knows no one. It is as if he knows no one. I know no one. Where am I? Only I don't know what is this ulcer. What is going to happen? Knows no one. Screams, help me, help me, help me. This is the whole state of stramonium. Clinging, take hand or part of mother. Why mother? It doesn't actually directly mean a mother. It could also mean mother-like figure. Mother-like figure could be a doctor, could be a friend. It could be anyone who gives unconditioned love. So the feeling, clinging, doctor, doctor, please help me, help me, help me. Stramonium, are you all with me? Are you getting this patient's experiences? I'm trying to tell you from different clinical experiences. Just a very interesting rubric. And that's one of the main rubrics for me to understand stramonium. From the mind section, you should remember this very beautifully. Delusion alone in wilderness. This is a very important kind of state of stramonium, where this patient of stramonium starts feeling, starts thinking as if he's alone. He's alone. He's alone in wilderness. Wilderness is jungle. So the whole feeling for stramonium is as if I'm alone. I'm alone in the jungle. I can be attacked from anywhere. So the patient will often come and tell you, doctor, you are homeopathy doctor. I know you will treat me. I don't want to go to hospital. I don't want to. Once I go in hospital, they put injection. They will put IV line. One doctor will come, will tell me something. Another doctor will come. They will tell me, do this scan, that scan, this, that. No. I'm totally alone. I know no one. I will be totally alone. Everyone will attack me. Delusion alone in wilderness. So interesting. Constant shrieking. They will scream for help. Children, the stramonium children are the best. Very beautiful. They will come inside, typical stramonium. I had a stramonium case. The child will come inside. He will look at you. Huh? Because, the child has taken so many vaccinations that he remembers that every time he goes to a clinic, he meets a doctor, he knows he's going to get an injection. So suddenly the patient, the child, the stramonium child remembers the injection, the pain, the injury. This man is going to give me injection again. And he starts screaming. He tells his mother and father, let's go, let's go, let's go, let's go from here, let's go from here. And the stramonium child will take the hand of mother and father, and he will pull, let's go, let's go, let's go, let's go. Stramonium, ladies and gentlemen. This is stramonium. You don't have to ask questions to stramonium child. You will just see and you will know this is stramonium. Very interesting rubric. What is the main feeling of stramonium? Look at this rubric. See how they experience. Stramonium is not only scared of death. How do they look at death? You ask them. He will say, I'm scared of dying. What do you mean dying? For stramonium, dying is not like just dying. For stramonium, the whole imagination of death. How does he perceive death as? Is a very beautiful rubric you can see. Delusion, murdered, killed, roast, and eaten. So the whole feeling is as if someone will come and basically roast you and eat you up. This is the whole experience of stramonium. Can you imagine? Can you imagine how stramonium looks at life? Anything which is different, they feel, Hare, huh? Murdered, killed, roasted, and eaten. Can you imagine this rubric? Can you imagine how stramonium must be looking at life? So interesting. Stramonium patient will come and tell you, doctor, yesterday night I went to my friend's wedding, and today morning I got up, I started getting so much pain in the abdomen. Something very strange. Will I have to do some X-ray or some sonography or some investigation? Will I have to do something? This is so strange. I've never experienced this before. I have never experienced. I think this is something different. You don't think this is something very different, no? Some big illness. You don't think this is some very big illness, no? You don't think this burning is not some that illness, that illness, you think? This is how stramonium looks at them. Everything, they are very scared of anything new and strange. That's a very important state of stramonium. So, a very important rubric for stramonium is, have a look at this. Delusion, everything is strange. Delusion, familiar things are strange. Delusion, friends are strange. Delusion sees strangers. It's the strange thing. Everything was normal. What is this? This is, Hare? This is strange. This I never felt before. Strange. Strange. Very important rubric of stramonium. Strange. Let's go further. What is it that stramonium wants? What is it that they long for? Kent has written beautifully. The main thing for stramonium is sunshine. They want sunshine. They want the light. They can't take darkness. And they want society. They want people. They want to talk. They can't be alone. Stramonium is happiest in the daytime or at night when the light is on, or when he has people in or around. If he's alone, he's gone. Boger synoptic key. Let's see. My favorite materia medica. So stramonium has a lot of action on brain, and that's why stramonium is a very important remedy for brain-related problems. And that's why stramonium I also use in many autism cases, ADHD cases, behavioral disorder, psychiatric disorders. Action on circulation, throat, circulation, skin, spinal nerves, arms, hip, left hip joint. Herring has written about this. Spinal nerves, genital. So this is the whole sphere of action. Worse by glistening objects, bright thing, fright. Worse after sleep, like lachesis. Worse by dark, cloudy days. Why dark? Because they are scared of dark. Worse by suppression. They are getting cough or urine, and due to allopathic medicine, it's suppressed. They will start getting convulsions. Better by light. Better by company and warmth. This is typical for stramonium. What has Boger written very nicely? A remedy for terrors, but lacking in pain. So it is one of the remedies which is painlessness. They are very scared and there is not much pain. Suppressed symptoms, suppressed discharges. Passing neither urine nor stool. So retention of urine, retention of stool with lot of fear. Something they see, something scary, and then they just cannot pass stool, cannot pass urine. Urine becomes retention, paralysis of bladder. Think about stramonium. Very important for neurological cases, involuntary movement, convulsions, rhythmic, graceful movement, stramonium. Chorea, stramonium. Wildly excited, night terror. Suddenly, she's sleeping at night, suddenly she'll scream. Stramonium. Sometimes they can become very stupid. Sometimes at a later stage of stramonium, they might get imbecile. Fixed sparkling stare. They will stare for a long time like this. They may develop squint. They are very scared of black. The black color reminds them of terror. That is the thing. That's why stramonium, because of so much of fears in their childhood, develop a lot of symptoms like stammering, like spasms, involuntary jerking, convulsions after fear. Remember, very scared childhood, very terrible childhood, very abused childhood with so much of fear may require stramonium. If the child gets stramonium at that age, at a later stage, he will not develop pathological symptoms. Frowning, like lycopodium, frowning, but frowning is because of fear of stramonium. Painless involuntary diarrhea. That's why very important for IBS, irritable bowel syndrome. Nymphomania, but not as shameless as hyoscyamus. Non-appearing exanthema. Eruption doesn't appear, but start developing neurological symptoms because immunity is very low. Unilateral paralysis with twitching. So one side is twitching, another side is paralysis. Stroke patient, apoplexy. Crawling as of many bugs. So many neurological symptoms. This is Lane-Genman stramonium. So interesting. I think very beautifully, the best thing you can do after today's talk is go and read Kent Materia Medica, stramonium. And so beautifully, only first line of Kent. When considering stramonium, the idea of violence come into one mind. So amazing. Kent really was a romantic writer of homeopathy. If you are wanting to do romance with Materia Medicas, read Kent. So beautiful. Now, I think I can probably, just before I finish, I'm going to take some question and answers. But what is the homework for today? First, you write to me right now. What did you learn today about stramonium? Number one, you write to me. You have my email ID, all of you. Number two, you have to read stramonium, hyoscyamus, and belladonna from all the books. You have to read from Kent Repertory, you have to read from Allen's, you have to read from Clark, you have to read from N.M. Chaudhary, you have to read from Dr. Sankaran, Soul of Remedy, everything. And once you read it, then you make a table how to differentiate all these remedies. This is your homework for today.